Ladies and gentlemen, welcome once again to the Think Like Car podcast. My name is Hamza. Amazing to be here once again. Today we are going to be looking at a couple of things around just how you bring AI solutions to the right audience. So we are going to be looking at how we would, when deploying AI solutions, especially in the healthcare sector, how do you bring these AI solutions to specific healthcare audiences? And this podcast would apply for those who are into building healthcare solutions, for healthcare technology companies that are looking to implement or deploy their software into the healthcare system, for healthcare leadership or executive team that's looking to either partner or deploy AI systems or healthcare solutions in their system. What should you be looking at? Because when you look at this, how do you bring a solution to a specific audience? How do you solve the problem of the different groups that you have in your hospital? Or how do you build a solution that actually meets the needs for every single group, for physicians, for nurses, any group that you're targeting the hospital? How do you do that? Because the fundamental mistake that people make here and when they implement AI solutions is that they usually will start with the technology, and then they will find a problem that to solve it. So they flip them. So what you need to do when you are even conceptualizing the idea of either building a product, or as an executive you are looking at solutions that you could implement, what you need to be looking at is you have to start with a specific audience problem. What are my family physicians or emergency physicians or specialists? What are their specific problems? What are the problems of these groups of people? What problems do my nurses have? What problems do the patients have? So you're looking at the specific audience problem, and then you're designing or adapting the AI solution that will address them, depending on who or where you are in this whole conversation. So you are considering the difference between two. So let me give you an example. You are considering this difference between two systems, right? Now this is an AI documentation tool that you are trying to implement, and you're trying to look at the difference between them. Now you have two companies. You have company A and company B, right? Company A deploys a solution, which is the approach most people use. They deploy the technology, and then they find the problems that it can solve, and then sell it outright. So company A said, okay, we are writing this documentation tool, and this is what it's going to do. It's going to do all these things, and then now they're looking at the setting and looking at, okay, you as a family physician, these are the issues you have, and this is how this solution system can help you. And then company B decides to deploy three different systems. They decide to deploy one for their family physicians, they deploy one for emergency physicians, and then they deploy one for specialists, right? Now the adoption rate for company A, even though you might find bits of those solutions all in one, the adoption rate for company A is 31%, right? And the adoption rate for company B is 84%. Now the question I have here is that, are you surprised that these two companies are seeing different adoption rates? And the answer is yes. You shouldn't be surprised. And the understanding is that company B has taken its time. Instead of building the solution and looking for the problem that it will solve, they actually went to the audience specific problems that they wanted to fix, and they fixed them. I would explain and I'll break this down. Now when you're coming into a healthcare setting, one of the things and one of the codes that I've seen that really defines this well by Dr. Atul is that AI doesn't solve problems. AI solves specific problems for specific people in specific context. So you can't just use generic AI solutions to create from the same quote, he said generic AI solutions create generic disappointments, which means that you don't just go building a tool and now looking for a problem that tool can solve. So, and that is what happens mostly in that space now. And again, AI doesn't solve solutions. AI solves specific problems for specific people in specific contexts. So generic AI solutions will create generic disappointments. This is one of the biggest codes that really summarizes everything I'm trying to say today. Now, I'm going to be looking at this in the different groups of people that I just mentioned. I'll look at this. If you were thinking about an AI solution for primary care providers, what do you need to know to be able, or if you're looking at deploying an AI solution for primary care providers as an executive, what do you need to know, or what do you need to be looking at to be able to deploy the right product? We'll start with that. We'll go on to emergency physicians. We'll talk about specialist care. and then we'll look at patients, we'll look at nurses. I'm going to look at all these categories so that when you are deploying a problem, you are going to be looking at audience specific problems before you build the solution. Now, when we look at primary care providers, it's one of the most complex audience that you're going to have for the following reasons. One, the breadth of conditions that they have to look at is huge. They take care of everybody. Secondly, it's very important for them to have longitudinal relationships. And the third one is that they need for holistic patient understanding. So they need a more holistic patient understanding. So when you look at One Medical's AI implementation strategy, it exemplifies the audience first approach. Now, instead of deploying general purpose AI tools, they deployed AI systems specifically designed for primary provider workflows. Now, it identifies system gaps. It analyzes patient records. It identifies preventative care opportunities like mammograms, like colonoscopies, like vaccinations, and it seamlessly integrates all these into the system. So then the primary care physician is seeing a lot of value in this. And when they do that, results are always compelling. Let me share that with you. Preventative care completion rates increased by 47%. Physician reports spending 23% more time on patient counseling rather than care coordination. But here is also the sophisticated part of it. The AI learns from every physician. So depending on your philosophy as a physician and how you like to approach maybe the same condition, but how you like to approach it, it actually learns your pattern and it starts to adapt its recommendations based on your pattern. So let's say, for example, Dr. A would prefer to address maybe a cardiovascular risk factor before going into the main or the other conditions, and maybe Dr. B focuses on the mental health screening before they go into other thing. It will adapt to some of these ones. Zoom's healthcare primary care AI provider is another excellent example. So their system focuses on unique challenge of primary health providers, which is managing the complex undifferentiated symptoms, because the patient is going to sit in front of you and tell you a spectrum of problems that they have and require you to give them a solution. The AI also analyzes patient reported symptoms, medical history, social determinants, and all that. Now, the impact of primary care health workflows is enormous. So when you look at visiting times with a system like this decreasing by 1.8 minutes, and clinician quality scores going up by 22%, they report feeling more confident, like from physician standpoint. So again, when you are looking at it from the audience specific problem and building the solution, these are some of the examples that you get, and this is how you should think about it when you're looking at primary care providers. When you're looking at emergency providers, it provides also, again, they have the most challenging audience and the need for rapid decision making because they are moving so quickly and under pressure, and there's a lot of high stakes and different clinical scenarios and extreme time constraints. You have to think about your solution in this context. How does it fix their problem? How does it fit into their context of needing to make decisions quickly, like we talked about with the Kissinger health systems, which is used in emergency rooms, the high stakes with all the clinical decisions they make and the extreme time constraints that they have. How do you build a solution that fits into this? And now when you look at all the solutions that have come up, like the Cedars-Sinai AI strategy, it addresses that specific environment. So the system will charge, will analyze patient symptoms, we'll look at their vital signs, we'll look at the historical data to predict acuity levels and resource needs, and then they go ahead to now look at how they integrate this into the workflow and build it out for you. So again, when you're thinking about emergency physicians, this is how and what you should be looking at when you're trying to build a solution to them. When you look at other systems like some of the emergency physicians think about, like for sepsis diagnosis, for instance, the sepsis detection system, for instance, let's look at the Johns Hopkins emergency department. We look at speed and a precision balance, because that is how that system was built. So the AI will continuously keep monitoring patient data. They will be providing sepsis risk alerts within 6 minutes of like any concerning changes, And the early warning signs have reduced sepsis rates by about 21%. But the real innovation is the alert customization, because the emergency physician can be overwhelmed by AI alerts, leading to them being like alert fatigued. So it actually helps them to be able to determine how much of the alerts they want to be getting from this system. Let's look at specialty care. When you're thinking about building a solution for specialty care, that's another different challenge. They are already expressing what they are doing. So the AI system that you are building for them must amplify rather than replace the expertise. So anything that you are giving them should expand their decision-making process and not constrain them, because they are already expressing what they do. So when you look at the oncology AI system that demonstrates and Memorial Sloan Kettering, rather than suggesting treatment, the AI system synthesizes research evidence, patient data to support clinical decision making. That is what at the specialist level you need. So again, this just goes back to talk about the fact that you cannot implement just one AI system and expect it to solve all problems. You have the solution and now you're looking for the problem to solve. Okay, so when you look at radiology, it represents another specialty where AI has amplified expertise a lot. So it doesn't replace the radiologist's interpretation, it provides second opinions. And I've seen this in dentistry, I've seen this in medicine, where AI systems for radiologists are seen or interpreted as second opinion tools. When we look at nursing, if you are building a system for nursing, nursing represents a critical underserved audience when we look at all AI systems. So despite being the largest healthcare force, the challenge is unique. Nurses need AI systems that support care coordination, that support patient advocacy, and that supports clinical surveillance. I'll say that again. When you are thinking of building or deploying an AI system for nurses, look at one that supports care coordination, look at one that supports patient advocacy, and look at one that supports clinical surveillance. Now, at Cleveland Clinic again, their nursing-focused AI system addresses the specific challenges that they face. It's continuously monitoring patient data across multiple systems. It's identifying risks for falls, pressure ulcers, clinical deterioration, etc. So what you would now see is that the key design element for this AI system presents information in a nurse-friendly format that supports them to plan rather than diagnose. So they are planning, they are not diagnosing. So it's presenting this information to the nurses to plan. If you know someone's going to get a pressure sore, they are already planning for it, not to diagnose a pressure sore, right? This is how you think about it when you're building a system for nurses or deploying a system for nurses. When we look at the patient or the family engagement, this is the ultimate audience. These are the people who bring you revenue. So when you are building an AI system or you're thinking about AI system that targets patients, they are often overlooked in the implementation strategy. So the challenge in creating AI systems that empower patients while maintaining appropriate oversight is what is making it difficult for people to even think about it. So if you look at, I'll talk about Livongo again with the diabetes management. This is a client or patient-centered design, and the system provides real-time glucose insights, it provides medication reminders, it provides lifestyle recommendations directly to the patient. So they saw patient-centric problems and they went for it. But again, when you're looking at this, you have to make sure you're looking at it from all angles. Now, I'll say this. When you're looking at the audience mapping framework, AI implementation requires a systematic approach to the audience analysis. So you have to, so when you look at leading AI organizations that use AI mapping framework, that's what I call AI mapping frameworks or audience mapping frameworks. It provides a structured approach to understanding specific audience needs and is really designing the appropriate AI solution. So the framework includes 4 key elements. Now, when you're looking at this audience mapping framework, look at your workflow analysis, that's 1. Look at your pain points, that's 2. Look at identification. Look at, when you're looking at these, you have to look at them from workflow analysis, look at them from a pain point identification, look at them from success metrics definition, and look at them from adoption barriers assessment. I'll say that again. The framework of the audience mapping framework, which that's how I see it and that's how I want to call it, is that it includes, when you are designing an AI or deploying an AI system, do a workflow analysis. Make sure you have identified all the pain points. Make sure you have a good definition of what the success metrics would look like, and all the barriers, you have assessed all the barriers to implementation. When you're able to look at this, and we look at Kaiser's AI implementation system, for example, it conducts a very thorough workflow analysis for each target audience. It identifies specific pain points and inefficiencies, and is able to help emergency physicians, which is like diagnostic uncertainty due to the time pressure, to be able to make decisions on the fly and be able to go out with it. So in summary, when you're trying to look at AI systems and looking at either building them or deploying them as a leader, you have to be able to really evaluate how or what backs that AI system. If you go in for a one-size-fits-all system that you think would be work for all the different groups of people that you have in the hospital, what you may end up struggling with is adoption. You may end up struggling with people who really do not want to use it because it's just not a very good specific tool for their specific problem. So always look for the audience specific problems and go back and build or deploy the AI solution that does it. This has been another episode of the Think Linker podcast. Thank you so much and have a beautiful day.